In this unit, we are looking at settings-based health promotion. And the idea with settings-based health promotion is that like people live places, they work places, they like play in places. And if we can somehow change the design, the structure, the environment of a particular place, then ideally we can do that in a way that also promotes healthier decision making. So the built environment, healthy hospitals, healthy schools, all of these are really potentially enabling factors that can promote health. And when I say the built environment, I'm trying to contrast that from like the natural environment. We are talking about environments that have been built by humans. So think of like buildings and cities and all the various structural elements that humans have built that sometimes can promote physical activity and other healthy behaviors, but sometimes can take away from that as well. So what we're going to use to go through this concept is something called BC's, British Columbia's Healthy Built Environments Toolkit. There are many different ways of looking at the built environment, but I like this toolkit. It's really meant for like planners, urban designers, etc., to think about how we can create healthier spaces for the people living here in the Lower Mainland and beyond. So we're going to focus on 5 main areas that are part of the built environment: neighborhood design, transportation networks, natural environments, food systems, and housing. So let's start with neighborhood design. Like, how is a neighborhood designed, as the name implies? And in the toolkit, they identify 4 main components of healthy neighborhood design. So first of all, creating complete neighborhoods through mixed land use. So when I say mixed land use, what I mean is like, it actually has a lot to do with zoning, right? The zoning laws of a particular area and whether things are zoned to have both like commercial, like stores, etc., and residential, like where people live, etc., in the same environment. You know, when I think of good mixed use, I think of, you know, where I used to live in North Van, in Lower Lonsdale, on the second part of that image, or I think of like Main Street in the Lower Mainland, or even Gastown, where there's like people that live there. They don't have to go somewhere else. They don't have to drive somewhere else to be able to like do the things they need to do, right? Everything is kind of there. You're building this complete neighborhood that like caters to the things that you have to do. Whereas a lot of more rural settings, they don't have these kind of complete neighborhoods because everything is so like sprawled out, right? Where someone, like, there's a residential area here, but then you have to drive somewhere. You always have to drive everywhere to be able to get to your services. Okay, so that's one aspect, complete neighborhoods, mixed land use. Also, more compact neighborhoods, first of all, that can help with socialization, but again, it kind of speaks to this idea too of being able to live and work and play in the same environment, so you're more likely to like walk places instead of driving. Something else that's part of neighborhood design is efficient and safe networks, which speaks a little bit to transportation as well, so I'll get a little bit more to that when I get to that. And I laugh with the last one. Prioritize new developments within or beside existing communities. So if we're going to build this new like community, let's say like Brentwood as a local example, you know, are we doing that kind of in the middle of nowhere, or are we doing that within a city or within a neighborhood design that's already kind of there? So I don't have to keep like bringing in new services. Those services are already there, and now I'm linking people up. So I'm linking people up, I'm helping them move around more fluidly, and ideally linking them with the services that they need, which, like I said, could potentially promote physical activity, maybe reduces stress. It kind of depends what we're talking about here, and maybe even promotes social connection too. Okay, so an example of compact neighborhoods and some of these design elements we just talked about is a project by Squamish Nation here in the Lower Mainland called the Sanakwa, I'm probably saying that incorrectly, development, which is just around where the Burrard Bridge is, where they are designing all these new, or the plan is to design all these new towers right near where already there is infrastructure, where there already is transit lines, and ideally building them up with a lot of like green spaces too, which I'll come back to as well. Okay, so we don't have time for me in this video to go over the next few slides, but why I wanted to put them up here is that I wanted to give you some more ideas of what is considered this more health promoting neighborhood design. Okay, and we talked about some of these things as well. Number 2 is all about transportation networks, and this is about like linking communities as effectively as possible, and having lots of opportunities for people to get places, but also like walk places too, not just having to drive. And I keep talking about minimizing driving and prioritizing like active transport as like promoting physical activity, but also healthy design is minimizing the amount of pollution. And if we have good transportation networks where people are connected by means that aren't just like single people in single vehicles all the time, the net footprint of having more of these like transportation networks like trains and buses and all these things is that you take cars off the road too, which adds to the air quality of a particular environment. Okay, so make active transportation networks safe and accessible. So that's part of it too, to make sure that if you are designing a SkyTrain station, make sure that it is safe, well lit, easy to access. Designing connective routes that support multiple modalities. So a good example of this is like the planned gondola that is meant to run between Production Way Station at the bottom of the Burnaby Mountain and SFU. And the idea would be that like some people are going to like bus to a particular SkyTrain station, and that SkyTrain station is connected to another SkyTrain station, maybe, and that SkyTrain station ends up somewhere where then you can take a gondola to get up to SFU. So you can zigzag your way to where you need to go as effectively as possible. And in this case, we're combining multiple modalities to do that. Okay, so part of having good transportation networks is some of these like bike routes, walking routes, and of course like these SkyTrain or like metro routes as well. And I actually have 2 images here of the metro route. The one on the one on top that says fast and frequent transit service. That's the actual current Vancouver transit system. But someone on Reddit a number of years back drew kind of an ideal, like what would be the like dream scenario for a transportation network. And again, it's about getting people moving. It's about connecting the city better, connecting people better, and ideally taking some cars off the road too. Okay? And there is research that goes into this too, that places that Canadian cities, Canadian environments where there are more active transport options result in people being more active. Right? So don't worry about the statistics themselves on this slide, but know that if you have a transit stop less than 15 minutes away, you are more likely to get more physical activity, right? More active transport. If you have a sidewalk on most of the streets around you, you're more likely to participate in active transport. If you have more areas for biking, you have more low-cost recreation facilities, which is a bit more neighborhood design, well-maintained sidewalks, less street traffic. All of these have, data points to support how they can promote more active transport, which ideally, like we said, is promoting higher levels of physical activity in people and also getting more cars off the road as well. Okay, so again, I'm not going to go over all of these different specifics, different ideas on how we can promote these healthy transportation networks, but this gives you some ideas. And if I were to pull one of these examples, for instance, you should be able to identify it as part of transportation networks. Okay, so the third component of the built environment toolkit is all around natural environments. And the 4 elements or the 4 main areas that they speak to in this toolkit: number 1, preserve and connect environmentally sensitive areas. So actually Metro Vancouver has some resources, some online resources that someone that's like in planning or street design or development that they need to check through to make sure that they're not doing anything in a sensitive environmental area, like the bog that is shown on the green bog that's shown on this map. And the idea is that we want to preserve those areas. That's why we preserve like Lynn Canyon. That's why we preserve some of the North Shore Mountains. That's why we preserve even Stanley Park in parts. We want to preserve these environmentally sensitive areas so they help to clean the air. They help support the important ecosystems and biodiversity that we find in there. But ideally also so they provide these natural environments where we can, connect with nature and thrive accordingly. Okay, so maximize opportunities for everyone to access natural environments. And as you start reading this, you really see how things are connected too, right? So maximize opportunities for everyone to access natural environments. Well, you need good transportation networks to be able to do that. And if you design a neighborhood properly, maybe there is a natural environment nearby. How can you make it so that is accessible for the most people, right? These things are not mutually exclusive. They work together, okay? Reduce urban air pollution by expanding natural elements across the landscape. And that project by the Squamish Nation, as far as like the design suggestions of what that might look like, is that there's going to be a lot of like green, a lot of trees around, a lot of hopefully opportunities to include some of these natural elements within the design of the building itself, right? Which increases the total amount of natural environments that we get to see and maybe experience. And then the last part of this that I thought was worth honing in on too, it says mitigate urban heat islands by expanding natural elements. So to understand this concept, we have to understand what a heat island is. And basically, the more concrete you have and the less plants, plants, algae, grass, all those kind of things you have in an environment. So the more concrete jungle you have, the more total heat that there is found in that environment, right? We have less ability to dissipate some of those heating elements, right? Whereas you see in more environments that have more trees, have more natural elements, that those kind of things help to keep the environment cooler, and which is obviously something that we want to focus on these days. So increasing vegetation in parks, increasing the number of trees, landscape architecture across the built environment that promotes these like natural elements. This is all things that can help mitigate some of the heat islandness of the concrete jungles that a lot of us live in. Okay, and then again, here are some more types of planning solutions that speak to natural environments. Okay, so the last two elements of the BC Healthy Built Environments Toolkits are, for starters, number one, food systems. Okay, and food systems, this speaks less to physical activity, but obviously more to food, and there is a relationship between the two. But the three main areas that they argue for was, number one, increasing equitable access to and affordability of healthy food options. And I would say that this is something that is quite difficult in a lot of major cities, and we can do that perhaps with community gardens, perhaps with food banks, perhaps with food pantries, sometimes with like subsidies as well. But I disagree with the fact that this is how it is right now, that there's equitable access to food. But it's good that they're including this as something to think about when we are designing communities. Right? But making sure we have good food systems is also about protecting the land where we could grow food, right? And we see that a lot in the Fraser Valley as well, where there is a lot of green space and a lot of agriculture as well. But, as more developments happen in those areas, we're losing some of those previously farmlands, right? That's happened in Richmond too as well. We're losing some of these previous farmlands where we're no longer able to grow food. And because we're doing that, there's less local food, which may have an effect on food prices and affordability and equitable access too. So you can see again how these things were related to each other. And then support community-based food programs. And yeah, I get a little depressed when I read through this, because it's all great to say these things, but I don't know if they're always that it's not that they're not effective in practice, it's just that there's so much politics and planning and, running up that hill when it comes to creating these community programs. And a lot of people that run them are doing them out of a labor of love, even though they're making no money off of it, and it's costing a lot of time and effort. But it's important to support them. I'm just being honest about how it's not always the case that this is something that's promoted. But again, something in BC Healthy Toolkit as far as promoting a healthy built environment. And again, some ideas to think about as well, that actually what can you do about it? Okay. And then the last also worth a laugh element of BC Healthy's toolkit of the built environment, I keep saying the words wrong, but you get it, is all around housing and affordable housing. Prioritize affordable housing options through diverse housing forms and tenure types. Probably live, if you're one of my students, you probably live in the Lower Mainland in close to Vancouver, British Columbia, and we're like the second most inaffordable place in the world next to Sydney. It's not good. It's not great. And, one of the ways to mitigate the cost of housing is to build more housing, right? And build more options for people to live. But there's often a lot of backlash whenever that conversation comes to the forefront. You have, for instance, something that we sometimes call the NIMBY movement, which NIMBY means not in my backyard, as in, sure, build. These people are probably lived in a place for a while, and they're like, sure, yeah, build homes, sure, just not here, just over there. And the people over there are like, oh yeah, sure, build housing, help people out, just not here, over there, right? So some people don't like change. Some people spent a lot on what they bought and they don't want it to be any different. I get that. But we don't have enough housing, affordable housing, to house the people in Vancouver. And there are a lot of consequences of that. We've talked about complex systems thinking in this room, in this class, and we've talked about, for instance, the complexity of the unhoused situation in Vancouver, as well as the mental illness situation, as well as the drug misuse situation in Vancouver, and unaffordable housing. That's one of the elements that's linked in there, right? It's not all because of that, but these things are related. Anyways, okay, ensure adequate housing quality for everyone. Bringing up the downtown east side again, that is absolutely not the case. Even in these places where there is housing, sometimes people are housed in very decrepit buildings that are falling apart, that are fire hazards, and it's not great, right? Provide specialized housing options to support the needs of marginalized populations. Site and zone housing developments to minimize exposure to environmental hazards. So again, it's important to state that this healthy built environment toolkit, I would say it's more aspirational than what's happening in practice. And yeah, I'm glad that they're actually acknowledging the fact that housing is part of health, right? How can someone eat a healthy diet? How can someone get enough physical activity if they are so concerned about where they're going to live tonight, or whether the building's going to catch on fire, or, whether they can even afford rent? So we have all of these things are related, and the built environment is just one of the areas where we can potentially make a difference in people's health. But it's a potentially really potent one as well. But, health is complex, and this is just one area that we can potentially focus on. Okay, and again, a few more solutions. Prioritize a variety of housing forms, and mixed income housing develops to increase access to local, affordable, and diverse housing options, which helps people stay in their communities longer and improves their ability to afford other basic needs such as healthcare, nutrition, foods, while decreasing stress. I agree with everything that just said. But again, this is kind of brings up the concept of complexity, and especially when we're talking about affordable housing, we're talking about political, healthy public policy is what we're talking about. So advocating for that so we can enable people to actually live healthier lives, right? And it's just hard to do. But it's important to have these aspirations and to acknowledge that these things affect people's health, and we can make a difference. Even if we're not doing that now, that is something to aim towards. Okay, so built environment, it's all about like what is built, not a natural environment, but a built environment. And this is an area where built environment is like where people live and play and work. And if we can create healthier built environments, well, then maybe that creates healthy people without them even having to think about how to be healthy. That environment just promotes it and enables them to be healthy. Okay, so one element of settings-based health promotion, but a really important one.